Hey everyone, I'm Dr. Michael Breus, the Sleep Doctor. Welcome to another episode of Ask the Sleep Doctor. I'm on a mission to help people get the best sleep they can, and I love hearing from you. Every single week, I answer a few of your sleep-related questions. This week, I'm tackling some of your issues with CPAP machines. And please remember, this is not medical advice. I just don't have enough information on your personal case to be effective. You should always contact your physician with these questions as well. If you have a question that you'd like to see me answer, head on over to thesleepdoctor.com where you can send me an email. And while you're there, do me a favor. Scroll down to the bottom of the website where you can subscribe to our weekly email that's packed with all of my best sleep tips. Okay, question number 1. This comes from Carol, and she writes, I worked nights for over 25 years and I don't get to sleep until 5 or 6 a.m. I've met with a sleep specialist and had my home sleep study done. She says I have moderate sleep apnea and thinks I should be using a CPAP machine, but I don't want to use one of those big machines. I don't know what my question is, except maybe help. Carol, I've got some good news and some bad news for you. Moderate sleep apnea is a serious sleep disorder, and a CPAP machine works almost 99% of the time. So what I always talk to people about is give it a shot. Maybe try it for a little while, for maybe a week or two, and see how much better you feel. It might be a worthwhile trade-off if you don't like the machine, but you feel so much better. Also, you might want to ask your sleep specialist about something called an oral appliance. This actually replaces CPAP, but is a mouth guard that moves the bottom row of your teeth slightly forward, therefore opening up your posterior airway. This doesn't work for everybody depending upon the severity of the disease. Great question, Carol. Our next question comes from Maria, and she writes, I've been suffering from insomnia for many years. I took a polysomnography test last year. My diagnosis was sleep apnea. Now I'm using a CPAP machine, but I still have insomnia. Can I do something more? Great question, Maria. And the answer is absolutely you can. You have a situation where we would call something like that a dual diagnosis, where you've gotten your CPAP or your sleep apnea treated, but you've still got that level of insomnia. This is something that you need to go back to your sleep specialist and explain to them that you're still having difficulty falling asleep or staying asleep. A couple of the options that you could do here might be something called cognitive behavioral therapy for insomnia, or even looking at different relaxation techniques before bed, and finally, medications that could help you sleep a little bit more, but don't decrease your respiratory drive. All right, question number 3. Al asks, I've had sleep apnea for 20 years and I use a CPAP every night. I still snore, and the problem is my wife can't deal with the noise. 2 solutions, both not so good: sleep in separate rooms, which she hates, and earplugs, which she can't use. I need a solution. Please help. Al, I get this question all the time, and this is actually a really good one. The first thing I always have people do is, if you're still snoring while using the CPAP machine, there are a few things you might want to check. Number 1, when's the last time it was recalibrated? Sometimes these machines, like any mechanical device, can break down or not be as effective as they once were. Number 2, has your disease progressed? Maybe you need a higher CPAP pressure. That way it will actually reduce even more apnea and probably get rid of your snoring. Number 3, maybe a sound machine could be something that you could put next to your CPAP to slow down some of that noise so it's not so disruptive to your bed partner. Thanks so much for all of your questions. Remember, if you have a question you'd like to see answered here, visit www.thesleepdoctor.com/sleep-questions. Also, be sure to subscribe to my weekly newsletter as well as my YouTube channel, where I'll be giving you the most current and relevant answers to your burning sleep questions. This is Dr. Michael Breus, the Sleep Doctor, wishing you sweet dreams.